5, 4.
Hello everyone and welcome to the Health Channel, all health all the time. I'm Andrew Schmertz, coming to you from the studios of Baptist Health South Florida in Coral Gables. May is Melanoma and Skin Cancer Detection and Prevention Month, and with me now is dermatologist Dr. Annie Gonzalez. Welcome, Dr. Gonzalez. Thank you for joining us today. I think people hear skin cancer and they say, that's not so serious, but this is a disease that kills people every year.
Absolutely. Skin cancer is actually the most common cancer in the United States. Actually, it is estimated that 1 in 5 Americans will develop skin cancer by age 70.
1 in 5, 20%.
Absolutely.
And the leading causes of the skin cancer, who is at risk?
So the people most at risk are the light-skinned individuals, light hair color, light eyes. But darker skin patients can also develop skin cancer. Actually, these patients most commonly develop cancer in areas like the mouth, the palms of the hands, the soles of the feet, as well as under the nails.
And the main causes of this are the sun's rays. Talk about a little bit about how ultraviolet light is dangerous.
So ultraviolet radiation is actually responsible for more than 98% of the non-melanoma skin cancers and melanoma as well. So ultraviolet radiation is actually been considered a carcinogenic agent by the government because it causes skin cancer. And ultraviolet radiation comes in 2 forms. So we have UVA rays, which are called the aging rays, and these are usually responsible for the freckles, the sunspots, the wrinkles, the saggy and leathery skin. And then we have the ultraviolet B rays, which these are the sunburn rays. Both types of rays can actually cause skin cancer.
Interesting, and it's important to note, and we'll talk more about this in detail later, you don't have to get sunburned to put yourself at risk.
Absolutely. So accumulated sun damage, small amounts of sun damage that we accumulate on a daily basis would eventually increase our risk for skin cancer in the future.
And you mentioned people who have light skin. I know some redheads, and the joke is that redheads should never go into the sun.
Yes.
All of this. And why is that? What is the natural protection that some people are missing or have less of?
Right, so melanocytes, that's a cell that we have in the skin. So usually redheads and then blondes, these patients that are very fair skin, they don't have enough of these naturally protective cells on their skin. So that's why they're most at risk.
Okay, there's a range of skin cancers, like many cancers, from less serious to more serious. Why don't we walk through each one of them and start with basal cell?
That's right. Basal cell is the most common type of cancer there is. There's about 1 million cases diagnosed every year. These usually look like pinkish patches on the skin.
We have a picture of it here.
Absolutely. And they could also look like a pearl-like bump. A lot of patients often tell me these are pimple. I thought it was a pimple. So that's typically how they most often present.
And how do you treat a basal cell?
So basal cells can be treated in different ways depending on the variant of a basal cell. There's different subtypes. So sometimes these can be surgically removed. They could also be electrodesiccated, which is a type of, I often tell patients burning and scraping might not be the best way to describe it, but it's a way that patients can understand. Or freezing it. It all depends how superficial these are.
Okay, and that's the most common, you say, that people get. And the next one is, and I hope I'm pronouncing this correctly, squamous?
You know, you could say squamous. I often say squamous cell. This is the second most common type. About 700,000 cases are diagnosed every year. These can look like red scaly patches, but these often develop from chronic sores or ulcers that are not healing, so very important to pay attention. Also, patients that have a lot of scarring disorders, these are also at more risk for developing this type of skin cancer.
And that is treated similar to basal cell?
Very similarly, exactly.
And those two types of cancer, how lethal are they? How fast do they spread?
Right, so both of these are very preventable. They tend to be quite superficial, but if they're not detected early, that's where the problems come in, because they can invade vessels, they can invade nerves, and could be disfiguring to a lot of patients. Very rarely, some even squamous cells can cause death.
Okay, and the very scary fast-moving cancer, can be
Yeah.
fast-moving cancer, is melanoma. And we have a slide and a picture of what melanoma looks like. This is what you should certainly focus on, right?
Yes, absolutely. So melanoma can be deadly, and I think every patient, everyone needs to understand this. So usually when I tell my patients what to look for, we have the ABCDs of melanoma, and I try to teach them what this is all about. So A stands for asymmetry. So if one half of the lesion or the mole doesn't look like the other half, that's definitely can be a concerning sign. B stands for borders. So if the borders are poorly defined, very jagged, scalloped, that's another sign. C stands for color. So different shades of brown, or the American flag sign. That is if it starts developing shades of red, blue, and white. And then diameter. This usually refers to anything greater than 6 millimeters, which a pencil eraser is.
Yeah, you have a pencil here.
Right, so anything greater than this. The truth is I have diagnosed a lot of melanomas that are even smaller than this.
Okay, and this is something that appears on your body that you have not had before, right?
Well, so most commonly it does evolve from lesions that are completely new, but it can also evolve from lesions that are pre-existing, like most that we were even born with.
Okay, and how dangerous is melanoma if it's caught first early and then the stages?
Right, so there's several stages, there's 4 stages of melanoma. Melanoma in situ is considered stage 0, and actually the cure rate of these melanomas is very high, it's 99%. So that's how important it is to detect it early.
And that's simple surgery?
Simple surgery, okay. Right, wide margins, but surgery. If later on the stages are usually classified based on a TNM system, basically this just describes how thick or how deep the tumor is, then if it has spread to the lymph nodes, and then if it has metastasized or spread to other organs.
And at that point, it becomes difficult to treat, doesn't it?
Very difficult, and then that's where you have to involve other doctors, oncologists, which specialize in cancer, obviously, for even chemo and other sorts of therapy for these advanced cases.
And are you seeing an uptick of skin cancers over the past 10 years? You practice here in Miami. This is a state that people go sit out on the beach at.
Yes, so it is a very prevalent. Actually, we have a very high ultraviolet radiation index here in Miami, and the rates have exponentially increased in the last 10 years. Right now, it has increased by 77%, which is quite alarming.
That is alarming.
From 1994 to 2014. Actually, if we take it to 2018, I bet it's even higher.
What about the average age of patients? Are you seeing younger and younger?
Younger and younger, and a lot of it is due to the tanning bed use.
Oh, let's talk about tanning bed use.
Yeah,
yes.
absolutely. So because tanning beds do emit a very high concentration of ultraviolet A, which is responsible for that beautiful tan, but also we've seen a very high incidence of very advanced skin cancers, even in the darker skin patients that use the tanning bed, those users.
So tanning beds are not safe?
Absolutely
And not even safer?
No, actually, if I start giving you some statistics, it would be quite scary. About 59% increase in melanomas are due to tanning bed use, 67 from squamous cell carcinomas and basal cells.
It's amazing what
increase.
people put them through for just a glow, for a tan.
Right, so that myth that tan skin is a sign of good health and a symbol of beauty and youth, it's far from being true.
So where do skin cancers typically on the body appear?
Very good question. So actually, they usually develop in areas where we get the most sun, right? So this is usually involves the face. So we see a lot of those there. Our hands, the top of our hands, our forearms, our shoulders. So basically our entire trunk, the upper part of our chest, the neck. So these are the most prone areas. In women, we see a lot in the legs too, due to more sun exposure there. So
And sometimes on the back where you have trouble seeing. So you recommend that everybody check themselves and have somebody check themselves as well, right?
Absolutely. So I always tell my patients, do self-skin exams. And you should be doing this even once a month, once every 2 months, or have your partner look over your back since that's an area that you can't easily see. And everybody should definitely be seeing a dermatologist once a year for a total body skin exam.
And what kind of diagnosis have to be done we've heard the phrase precancerous moles. What do those look like, and how do you test them to make sure that they're not cancer?
That's a great question. So a lot of patients come to me telling me I have this diagnosis of precancerous moles and precancers, which are two completely different things. So with precancers, it's usually actinic keratosis. It's a proper term for it. These are lesions that can evolve into squamous cell carcinomas more precisely. So these are diagnosed daily, and typically we freeze these lesions with liquid nitrogen. And then the precancerous moles, these are dysplastic moles or abnormal moles, how I like to describe to patients. They're moles that start going through changes, so they're kind of that gray zone between not a completely normal mole, but not melanoma. So they do have some sort of potential to evolve into melanoma.
Does family history play a role in this type of cancer?
Absolutely, especially, any type of skin cancer, the family history plays a role, but ultraviolet radiation is definitely the most common risk. But for melanoma, even more so, genetics, those play a very significant role.
Talk about a little bit about how it's not just cancer, the risk of the sun, premature aging of the skin as well. So you're doing something to look good now, you're going to pay the price a little later in life.
Yes. So we've talked about how the sun ultraviolet radiation can affect quantity of life with skin cancers, but what about quality of life? That's where premature aging will come into play, and maybe this will make more patients, become sunblock users. But we see a lot of more sagging, premature aging, we see a lot more sagging of the skin develops more of a leathery texture, also more of the age spots, brown spots, freckles, wrinkles. So
if you have skin cancer, if you're diagnosed with any of the skin cancers, does that put you at risk for other cancers?
I'm sorry, can you repeat?
If you're diagnosed with any of the stages of skin cancer, does that put you at risk for other cancers as well?
Yes, great question as well. So every time I have a patient actually and they have been diagnosed with skin cancer, I see that patient at least every 6 months, because that does put you at more, that means you've accumulated enough sun damage to already have one skin cancer, so you're more prone to developing other ones.
That's really an important thing, so you go down that path. What does the treatment plan look like for skin cancer? I guess it really depends on the type and how advanced.
So the treatment plan, yes. So it does depend on the type of skin cancer. I like to sit down with the patient and discuss the different treatment options depending on the depth and obviously how invasive the cancer is. And obviously I always let the patient choose, but that's where educating the patient comes into play.
Tell me some stories about patients. Do the people who come in say, wow, I should have really paid attention to this and maybe spent a little bit more time at the library and not on the beach?
Exactly. So I say, it's not that you have to become a vampire and not go outside at all or do anything outdoors.
And we'll talk about suntan lotion soon, yes.
But yeah, it's just wearing sunblock. It's never too late to start. And even though, yes, you might start paying later on for some of the damage you did years ago, even as children. So it's really important to emphasize that to start very early on. It's never too late to start.
When did we start getting a concept of how bad the sun is for skin? I seem to remember it's like the last 20 years or so, I feel like people really started to get the message.
Yeah, I completely agree. I think in the last 20 years, I still have a lot of my patients that are definitely older generations, and they do say, it was the baby oil and iodine generation.
That's right. People used to put baby oil on to actually tan.
They really didn't know what the sun how harmful it can be to the skin. So the practice of sunblock was never popular.
And your people who come into your practice now, men, women, does it fall along gender lines?
Yes, so we see that in general, men don't tend to use as much sun protection, so the rates...
Men don't use protection.
Right, so the rates seem to be a lot higher and more lethal.
Okay. Have you or someone you love have skin cancer? What questions do you have for our doctors? You can email us at askthedocs@allhealthallthetime.com. Coming up, we're going to talk a little bit more about skin cancer, prevention methods, and of course, suntan lotion. Stay with us on the Health Channel.
Even with Medicare Part D coverage, about 5 million adults aren't taking their blood pressure medicines as directed. So why does that matter? Because high blood pressure is one of the leading causes of heart disease, stroke, kidney disease, and death in the United States. Along with healthy food choices and regular physical activity, blood pressure medicines reduce those risks, but only if prescriptions are filled in the first place. And 1 in 4 adults with Medicare Part D skip doses or stop taking their medicines altogether. Ask questions about how to correctly take your medicine and why you need it. It's easy to download free tip sheets and tools to help you or your loved ones take their blood pressure medicines on time and in the right amount. To learn more, visit millionhearts.hhs.gov.
Welcome back to the Health Channel. If you're a sun worshiper, you're going to definitely want to watch our next segment. In fact, if you're outside at all, you should watch our next segment because we're talking about skin cancer as well as skin care. And our guest today is dermatologist Dr. Annie Gonzalez. She continues with us now. I want to talk a little bit about suntan lotion. There's a lot of myths out there about how to properly use sun protection. So let's run through it a little bit. What is the best type of suntan lotion and how often should it be applied?
Yes, there's a lot of myth and it could be very confusing to patients. Once you go to the drugstore, there's a million of them and you don't even know where to start. So I'll start by going into the SPF topic. A lot of people don't know what SPF actually stands for. So S stands for sun protection factor. So, and then you have a number behind that. So, which is usually 15, 30, and it goes on to 100 and even higher. And this basically tells you how much of ultraviolet B radiation is actually being blocked. Now, often I know that patients tell me it's 15 and 30. Does that mean 30 is double the amount of protection than the SPF 15? Well, not necessarily. Actually, studies were conducted, and the SPF 15, for example, blocks about 93% of these ultraviolet B, which are the sunburn rays, while an SPF 30 blocks about 97%. So it's not necessarily double, but it is wise to go a little bit higher. So I usually tell patients to use an SPF 30 or higher.
But I've heard that
on daily use.
I've heard that at some point above 30, it's not worth the money to pay for too much higher.
Right, and that was until very recently the idea. Very recent study actually published in the JAMA did reveal
and
that
JAMA is the journal.
It's a Journal of American Academy of Dermatology. It did reveal that it compared the SPF 50, again this was a very small study, SPF 50 with SPF 100, and they did see less of a sunburn immediately after the exposure of 6 hours, I believe, and then about 6 hours later they saw less redness between the two. Again, not significantly higher, but there's a little bit of extra protection you could actually get.
So you can enjoy the sun if you put on the proper protection.
Yes.
Just apply it generously and frequently.
Let's talk about generously,
okay,
because I think that's another common mistake. Lots of patients don't apply enough. So actually a shot glass, I guess a lot of us can relate to how much of a shot glass is. This is what I mean. That's what you should be using to cover the entire body. And if you're just covering your face, that's about a nickel size amount. You should reapply every 2 hours, which is another common mistake. Lots of people put it on in the morning and they forget about the rest. Well, especially if you're gonna be outdoors, you wanna reapply that sunblock every 2 hours. With the exception of the water resistant or waterproof. That's also another topic of confusion. So there's no such thing as a waterproof. We have water resistant, which means that the sunblock is only going to be effective against water, sweat, for a particular amount of time, and that usually has to be specified in the bottle. It would say 40 minutes, water resistant 40 minutes, water resistant 80. So if it's 40, you have to reapply before the 2 hours.
And it's important to emphasize that you should put suntan lotion on not just when you're sitting by the pool or out by the beach. I have a convertible, and I'll put the top down and I won't think about it, but an hour in a convertible is an hour at the beach, right? And people are people starting to wear suntan lotion as part of their daily routine of just going outside?
I think safer practices, we are trying to educate as much as possible, and it is happening. But that's another thing. Patients say, I don't go outdoors. I'm just driving from home to work, and that's all I do. Even if you don't have a convertible, you're still getting ultraviolet radiation, even more so UVA rays. Through that windshield, reflection plays a big role.
Through the windshield.
So especially a lot of UVA rays, which are the premature aging rays that I was talking about before. So those are not the ones to burn you. So the patient will say, no, I don't burn if I'm in the car. No, you do accumulate all that ultraviolet radiation, even as you drive, even if you didn't have the convertible. And you still it's gonna turn into skin cancer later on.
What about eye protection? That's also important, right?
Very important. And interestingly enough, a lot of the more expensive eyeglasses don't have a lot of the ultraviolet protection. So
that is interesting.
But always read the label. So that would also be very important to protect the eyes and the area around the eyes, which is a very delicate skin.
A lot of people are using self-tanners these days. Self-tanner, which also comes as suntan lotion. Are those okay for your skin?
Yeah, those are perfectly fine. So I tell a lot of my patients that's a healthier way of getting a safe tan. These usually contain a type of sugar, which is DHA, dihydroxyacetone, which when it interacts with the surface skin cells, it gives you a brown tone. So, but this is not a sunblock. So that means you still have to wear your sunblock on top of it. It's just to give you more of a glow or a color.
And that's healthy. Okay, we actually have a phoner. Dennis is on the line with some questions about the sun and the skin. Hi, Dennis.
Hi, Dennis.
Hi, yes, I do. Can I ask as many questions as you did?
Sure, go ahead.
Hi, Dennis.
This is a big topic in Florida where we have so many golfers, and I've been a lifetime golfer, and I'm in the sun all the time, all year long down here, and I've got Irish skin. So I'm really a candidate here for cancer, but I haven't had any except a little tip of my ear once, and Mohs surgery took that away. But my question is, are the sprays as good as the lotions? Because they're so much easier to put on.
Great question.
Yeah, Dennis, that's a terrific question. How old are you again?
73.
Oh, 73. So remember that statistic that I said at the beginning, by age 70, most patients would have developed some sort of a skin cancer. You say you've only had one and you had Mohs, which I guess we also should talk about that next. But you asked about sprays and sun tanning lotions. So it all depends if we're talking about that's another thing that I want to say, physical sunscreens versus chemical. Look at the ingredients behind that spray, because a lot of these spray formulations are actually chemical sunscreens, which are not very stable. It's a very difficult vehicle to formulate a good sunscreen with. So definitely look at the ingredients. I love titanium dioxide and zinc oxide. So if those are the ingredients in that chemical sunscreen, that's a perfectly fine option. But reapply. Also, protective clothing is great. If you're gonna be playing golf, there's sleeves now.
Hat. Big hat. And Dennis, stay on the line, but I want to ask you about his type of cancer. He had Mohs.
Yes, so Mohs is a type of micrographic surgery that was actually developed by a surgeon called Frederick Mohs back in 1938, I believe. This type of surgery basically removes skin cancer with very narrow surgical margins. So it's very tissue sparing, so to speak, with a very high cure rate. Why? Because we remove the skin cancer, and then right after we remove it and the patient waits, we go examine that tissue under the microscope to look for cancer cells. If there's any cancer cells remaining, we go back and then we remove only what's needed. Wherever we see there's still cancer cells left, because we do make a little diagram around this tissue. So that's why it's considered so tissue sparing. We don't have to get very large margins, only what's necessary. And like I said, it has a very high cure rate.
Dennis, any other questions?
Well, yes, and first of all, I wanted to say something else about Mohs. It takes off these microscopic layers, and they only go as far as they have to get the cancer. It's just terrific, and so it doesn't make a big scar on your skin if it doesn't have to.
How many years ago did you have the surgery?
About 5,
Okay.
and it's just great. So I actually remember now to put sun protection factor on the tip of my ears and along with my nose. But the question I had, a big question I have is, and you mentioned about age, is skin cancer an accumulative thing? Is it years and years of exposure? Or have I made it now since I haven't had real bad, except for the thing, have I made it now that I've lived this far without it?
Dennis, another terrific question. Yes, it is a product of accumulated sun damage, even if it's small amounts. When we start as children, we start accumulating all that damage. It's actually DNA damage that's occurring at a cellular level due to the ultraviolet radiation that would increase over time, so you can develop skin cancer, and actually the risk increases exponentially as we get older.
Dennis, let me ask you this, because you say you're out and active, you play golf, and you're about 70-something years old. How has your own mindset changed about skin protection since you were a kid?
Well, all you have to do is be married to somebody who who warns you all the time about how awful it looks when you don't have a nose. So at least I put my sun protection factor on my nose every day, on the tips of my ears, and I try to spray it in other places. But I am more and more concerned as I get older, because I'm getting sun exposure occasionally through my shirt once in a while. So I was wondering if there's some materials that are better than others. But I prefer to play early in the morning before the hot sun comes out. Is that really much better, or do I need to be concerned? I do need to be more concerned in the afternoon, right, when the sun is hot?
Yeah, yes, great point. So the sun is always strongest between 10 a.m. and 4 p.m. So if you can avoid those peak hours of sun, always go for that. Now, that doesn't mean that you don't have to wear the sunscreen just the way you've been doing. I would encourage that you put it everywhere that's going to be exposed, not just the areas that you think are most at risk, but just put it on your entire face, ears, neck, definitely the arms and hands. Now, in terms of protective clothing, you did mention there's some clothing out there that has ultraviolet protective factor that does block a lot of the ultraviolet rays, both UVA and UVB. So definitely, it's very important to try to look for that special clothing, because actually a white t-shirt is only an SPF or UPF of between 5 and 8. So it's not very high. Regular clothing, it's not as high as we think.
That's interesting. Most people think that if they cover up with anything, they're fine.
Yeah.
Dennis, thank you very much for the phone call.
Oh, thank you for the information.
All right. You're watching the Health Channel. We'll be right back.
This man, the sunburn.
Biodigital man.
Oh, okay.
5, 3, 2.
Welcome back to the Health Channel. We're talking about everybody's favorite topic, sitting outside in the sun and enjoying the outdoors and avoiding wrinkles and skin cancer, of course. Annie Gonzalez is a dermatologist, and she's been talking to us extensively today. Thank you for joining us.
Oh, thanks for having me. It's been a pleasure.
Let's look at a sample patient, if you will, and about sunburns in particular and how that impacts.
So yeah, this is a very sunburned patient that you brought me
correct.
here. So actually we have this biodigital man here exhibits a sunburn, and we have that the most prominent areas of sunburn include the area of the forehead, the nose is also very prone, the high areas, the high cheekbones, then the neck and the chest. So actually, these are probably the places where I remove most skin cancers from. So exactly where you're gonna get more sunburns, these are also the places that are more prone for developing skin cancers.
I understand if you have just one bad burn, you are at increased risk for cancer.
So yes, the statistics actually show that if you've had 2 blistering sunburns, even as a child, that would double your risk for melanoma later on. Just 2 blistering. If you've had any type of sunburn, 5 or more, at any age, that would also double your risk for melanoma. So actually, there's a very close link between sunburns and melanoma.
And sunburns, you don't have to have a sunburn to get skin cancer.
Correct.
But sunburns do particular damage to the skin. Oh, if you have a sunburn, how best to treat it? I remember using plants and all sorts of substances.
Well, aloe vera as a plant is actually, it's been commercially manufactured into a lot of gels and lotions. And it is perfectly fine because it's very cooling. So that's something else that we should do. The skin is very hot. It has suffered a lot of damage. These are basically all dead cells. So not much you can do to revive them. They're already dead. But for comfort measures, you could definitely use a lot of aloe vera, do cool compresses, and wear a lot of sunblock.
Of course, you want to avoid getting burned as well. So we should review this as well. Generously apply sunscreen, as you had mentioned.
Yeah, we want to be sun smart, and that's what I tell all my patients. So how to be sun smart? You want to apply a sunscreen SPF 30 or higher daily. Even on cloudy days, you got to do this.
The clouds aren't going to protect you.
Absolutely, there's still ultraviolet radiation coming through. So put it on every day.
We mentioned clothing. People think that if they cover up with anything, it will be helpful, but there is specific sun protective clothing you should look for.
Yeah, it's a little bit more expensive, but definitely worth that money because it actually comes with a designation of UPF and not SPF like the sunblocks. But this clothing, a UPF, for example, 50 on a shirt, will block about 2%, will only allow 2% of the UVA and UVB rays coming through. So it's actually very broad spectrum, these UPF clothing. So you could get hats these days, shirts, long sleeve, and they're actually, they leave you feeling very cool. Pants, anything, bathing suits, they're making everything. There's great companies out there that make great pieces of clothing.
Seek shade, an obvious statement. You're not going to get burned or damage your skin if you're in the shade. This is interesting. Beware of water, snow, and sand. Why?
These are reflective surfaces. So you got to definitely beware that even if you feel cool, you're not feeling hot, these are still surfaces that reflect a lot of these ultraviolet radiation and also increase the impact on our skin.
Get vitamin D. Now, a lot of people now have low vitamin D because they're trying to avoid the sun. So when you say get vitamin D, you mean take supplements?
And I would argue that I don't know if it's completely entirely because they're not getting enough sun, but also because of our poor diets. Yes, so a lot of people make that their excuse. I need vitamin D. But there's a lot better ways to obtain the vitamin D, perhaps get it through your diet and supplements. So don't make that the excuse to get sun.
And does vitamin D protect the skin? Is it a vitamin that's good for the skin?
It's a vitamin that we need for a lot of things. So, but the sun does allow a conversion of vitamin D into an active form of that vitamin in order for our bodies to be able to utilize it. So.
Okay. Avoid tanning beds. We had discussed this earlier. They are far worse than you think.
Oh, they are, absolutely. Very high concentration of UVA rays, but also some UVB that goes in there and has exponentially increased the risk of skin cancer in the last 15 years.
Of course, check your birthday suit. How often should you check yourself for skin cancer?
So self-skin exams, try to do one every couple of months or have somebody close to you perform one. And definitely come see a dermatologist every year. So that's why your birthday suit. So come in and have your dermatologist check you out. That's the most important thing. Don't wait for things to, when caught early, these are have a very high cure rate, very curable. So come in and get checked.
Come in and get checked. And you know, some people don't remember exactly where they may have moles. Maybe take pictures of your body and compare them.
That's a great idea. Yes, completely agree with that. And I have told some of my patients to do that. Take pictures with your cell phone, you know, well, not social media, but a lot of people are on their phones these days for everything. So put them to work and do something for you. It can potentially save your life. So take pictures to see if these moles start changing or if any new spots that weren't there before.
And you said you should see a dermatologist every 6 months. It's like getting your eyes checked.
Yeah, so I like to say every 6 months for patients with a previous history or with a very strong family history of skin cancer, and once a year if you have no previous history. But even in patients that have had a lot of other signs of sun damage, I like to see them every 6 months if possible.
And what age should people really start looking at their bodies for this? They should learn from teenage childhood. Do you see
a lot of children I see a lot of parents coming in to bring their children check moles. We have melanomas that evolve from congenital moles, which are moles that you're born with. So definitely these moles should be looked over, you know, from time to time, regularly.
If you want more information or if you have any history of skin cancers or want to ask some questions, you can send us an email. Go to our website, allhealthallthetime.com. A whole bunch of information is up there on the shows and topics that we cover, as well as information about what we're covering now on skin cancer. Where should people go for more information? Where do you like to direct people?
Well, the American Academy of Dermatology has a great website, lots of useful tools for patients to know what to look for, great graphics, so that's a great information. The skincancer.net is also a great source. So.
And let's go back to melanoma for often. How often in a month are you referring somebody to an oncologist, for example, because they have melanoma?
So I would say I probably detect the melanoma, and thankfully, you know, I have detected a lot of them very early. I could probably say I've had a handful of cases that unfortunately has been a little bit more invasive. But every 2-3 months, we do have melanoma that we're referring out to get followed by an oncologist.
Are people surprised that they have melanoma when they come in, or do they come in knowing something's wrong?
Most of the people, especially those very early melanomas, that a lot of them are not even 6 millimeters, like that pencil eraser that I showed you, they're very surprised.
It's not like they noticed anything?
No, because a lot of times it's completely flat. So they were expecting something a lot more obvious. And I do have some cases where it's even more advanced, those very few cases that I told you, that patient, a lot of those are in denial.
Okay. Some celebrities, famous celebrities have had skin cancer, Bob
Correct.
Marley being one of the most famous.
That brings up a very good point, because we think that usually only the light-skinned patients are the ones at risk for skin cancer. And Bob Marley, you know, being a darker skinned patient, you know, a Jamaican singer, he did develop melanoma under the nail of one of his toes. And because there's that denial component, you know, it's just due to trauma, it's not really being symptomatic, then you wait too late, and then you have an invasive melanoma that has spread to other organs, and it'll kill you in 6 months.
And what happened with him?
He died. I don't think he sought help, so. Yeah.
That's an interesting point, that African Americans and dark-skinned people are susceptible to skin cancer as well. And yet it's harder for them to identify it.
Very hard, because these are usually in places that are hidden from the sun, where you wouldn't think it's necessarily, it's more of a genetic component in there perhaps, because they develop usually inside the mouth, under the nails, the palms of hands and soles of feet.
It seems that this is a celebrity drought of spokespeople for skin cancer, right? We know celebrities talk about breast cancer. They have talked about pancreatic cancer because high-profile celebrities have had that. But there's not been this public relations, if you will, for a prevalent deadly cancer.
You're right, especially, you know, it's so preventable, and I think I think we should start a campaign or something. There should be more celebrities that should definitely raise awareness.
Do either you or your colleagues go to schools, for example, and talk to high school kids about a cancer that they're not thinking about at all?
Right, so you got to start from a very early generation, you know, as I said, childhood, and that sun starts accumulating since. So going to schools and teaching children you know, how to wear sunblock, and make it fun for them is extremely important.
What are you telling people who come in and don't have cancer right now, but you see them looking healthy and tan, and you say, you know, you might look good, but this is not good?
Oh yeah, I say that very much so, all the time. You know, as I said before, you know, tan is often mistaken as a sign of good health, and it's far from that. So even if I don't detect anything on that initial screening, I would tell patients there's other signs of sun damage that are present, and I teach them which signs these are. You know, premature aging signs, the sunspots, you know, the freckles, maybe, you know, changes in the texture of the skin. And even the precancers, the actinic keratosis that I said, which are very subtle a lot of times. You can only feel them, not even see them. So I would tell patients this just means it's continue to accumulate. So you gotta come in and get checked and most importantly, start using sunblock.
And to reiterate, it's not just skin cancer, but you're doing damage to your skin, and there's going to be wrinkles, and that has health consequences as well, not just wrinkles, right?
Yeah, but then they'll come in for other treatments, which you can also see your dermatologist for that. But yes, a lot of changes in the skin will result from ultraviolet rays.
So to recap, the key is protection, either clothing or suntan.
Protection, exactly. Lots of protection.
And the best suntan lotion is an SPF between 15 and above, depending on how long you're going to be outside.
Yeah, I usually like to say SPF 30 or higher. Make sure it's always broad spectrum. That means it will protect you both from UVA and UVB. So always try to look for if it's water resistant, that's another thing you want to look for. Reapply often, so at least every 2 hours.
And it's not just when you're on vacation. And it's not just the seasons of the year, right? It could be winter in New York.
Right.
And you should be wearing
suntan
lotion.
So as I said, even snow can reflect a lot. But even if it's not snowing, there's still ultraviolet radiation coming through, especially now that the ozone layer is becoming thinner and thinner. There's lots of ultraviolet radiation. So,
Dr. Annie Gonzalez, thank you for spending some time today with us.
Thank you so much.
And if you have questions for our doctors, email us at askthedocs@allhealthallthetime. That's the Health Channel for today.
Even with Medicare Part D coverage, about 5 million adults aren't taking their blood pressure medicines as directed. So why does that matter? Because high blood pressure is one of the leading causes of heart disease, stroke, kidney disease, and death in the United States. Along with healthy food choices and regular physical activity, blood pressure medicines reduce those risks, but only if prescriptions are filled in the first place. And 1 in 4 adults with Medicare Part D skip doses or stop taking their medicines altogether. Ask questions about how to correctly take your medicine and why you need it. It's easy to download free tip sheets and tools to help you or your loved ones take their blood pressure medicines on time and in the right amount. To learn more, visit millionhearts.hhs.gov.
Do you see that segment? Welcome back to the Health Channel, talking about your skin today and protecting your skin with Dr. Annie Gonzalez. We've covered a tremendous amount of ground. Most of the conversation has been about adults. Dennis phoned in and gave us an excellent story about his health and how he thinks he's done okay, even though he had a skin cancer, which was apparently successfully treated. And you have mentioned that 20% of people will have some form of skin cancer through their life.
Yes.
But they're not the only ones who get it. Infants and children, I understand, can get skin cancer. And how does that happen?
You know, it's definitely very rare that they can get skin cancer, but as I said, it's really important to start using sun protection very early in life. The problem comes in selecting a sunblock that we can use in infants. A lot of them do say 6 months and older. So that's where it becomes a little bit tricky for moms to determine what do I use on my 3-month-old. And usually the protective clothing that we were mentioning, especially if you go with the more superior quality, you know, the UPF clothing that has a special fabric and also has UV, ultraviolet inhibiting agents, They make a lot of actually very cute stuff that you can put on your baby. And this will be the safer option because a lot of these formulas, the sunscreens, have not been tested in babies that are younger than 6 months. So
That's interesting. What could be in it that could, well, first they could eat it, I take it, and
yeah,
the
also,
skin is...
you know, it's very hard actually to perform a lot of this testing on younger patients. You know, not a lot of people are you know, it has to be more with FDA regulations and things like that.
So do you see infants with skin cancer?
Extremely rare. I have never personally seen an infant with skin cancer, but there's been very rare case reports of infants with skin, not melanoma, maybe melanomas from congenital lesions, but not basal cells and squamous cells.
That's something related to the sun because of the sun damage. And I see parents in the carriages, they have the hood over it, and the babies are well protected. But in other cases, they're not. So people, they should, and then babies can't react when they are feeling the stress of the sun as much.
Exactly.
And for children, even once they get out and about on their own from 7, 8, 9 years old, they may not want to put on suntan lotion, right? They may push back. So how would you communicate to them that they got to wear this?
You know, now actually they make these little bracelets that they can wear that change colors with ultraviolet light, which is fun because even when it's cloudy and they think there's no sun out, they can see the change of the beads on the bracelets. So that's, for example, a tool that we use whenever we do lectures for kids, as we were talking about before. So, you know, you got to make it fun for them. Whether you use a sunblock that doesn't feel sticky, a lot of times they dislike the texture or the feel. So just making it a fun activity and really educating. It's like teaching them to brush your teeth. You know, this is part of...
And also maybe get them out of the culture of the sun worshiping culture. And that's relatively new to Americans, right? It's really the 20th century on, where sitting out in the sun was a sign of health and of prosperity.
Yeah, it's actually, and it's actually more prevalent in America. If you go to the eastern part of the world, it's all about the opposite. Being tan, it's usually more related to the working people. Usually more affluent people are usually, they're very protective, especially, you know, amongst Asian populations, for example.
That's interesting. And what is the demographic of the people who walk into your practice mostly?
So we see a lot of Hispanics here in Florida and Miami, but even Hispanics, they think that I'm not at risk. I'm Hispanic. I'm not that. The average one is not the blue-eyed blonde patient or redhead that will walk into my door, and I know for sure that patient is at most risk. And there's got to be a lot of education because we detect skin cancers on these patients every single day.
Okay, I want to put back up that graphic if we can of the different types of cancers again and walk through it with the images because I think it's really very important that if you can't prevent it, you need to take action as quickly as possible. So let's go to that graphic and again talk about basal cell, which is the most common type of cancer. And when we're talking about 20% of the people will experience it, this is the one most of them will do so?
Yes, so more than 1 million cases that we see every year. Skin cancer actually is very expensive to treat, and when we're talking about treatment too, we spend more than $8 billion just treating skin cancer.
$8 billion?
Yes. So, but yes, usually it looks like this, a pinkish scaly patch, or that might have a little central scab, you know, a scab in the center. Sometimes it can look shiny.
And does this sometimes come from an existing mole? And is mole the right word, by the way?
No, I wouldn't call the mole one. We usually like to relate more to melanomas. Basal cells usually doesn't look like a mole. You can say it looks more like a pimple. A lot of patients do say that, you know, I have a pimple that doesn't seem to go away. It's been there for months. Well, that's definitely not a pimple when it's been there for
months. Okay,
right.
And the next kind of cancer, of skin cancer?
So squamous cell, and this is a little bit of an unusual image. They can present in so many different ways.
This is one ugly cancer.
Right. So you know one thing when you look at this, it's not pretty. And maybe that's why most patients will come see me. You know, it could be like a little scabby growth. A lot of times we see it as something very discreet, something like a red scaly patch that doesn't look like much.
And where do you find these cancers on the body?
These particular ones, the basal cells and squamous cell, and also the melanomas in the more sun-exposed areas. So like that image that we're looking at before, where you typically get more sunburn. So we see a lot on the face, we see a lot on the upper part of the body, the arms, the top of the hands.
Okay. And the very dangerous cancer, melanoma. And here's a good look at what that looks like. And you mentioned the ABCDs in helping to diagnose it.
So yes, here we have a case of a melanoma that looks very asymmetric. So one half of the lesion has a completely different color than the other half. So that's the A that I told you before for asymmetry. Then we have the borders. It's got very scalloped or irregular borders. So something else, another very key feature. And then C stands for color. So we see one shade of brown on one end, a much darker, almost black around the other edge, and then that central white discoloration. Sometimes it doesn't have to be white. It could be bluish. It could be red. And then diameter, which is usually that 6 millimeter, but as I said, I've detected a lot of these much smaller than 6 millimeters.
Typically, is it just one spot on the body, or do people come in and sometimes have more than one?
Oh, typically I have more than one.
Oh, really? That's interesting.
Yes. So lots of times, some severely sun-damaged patients have so many spots that are suspicious that it's impossible to biopsy all of them in one, and that's when I have to sit down and come up with a treatment plan and say we have to do this in stages.
Okay. If you have some questions you want to talk to the doctor about, you can email us at askthedocs@allhealthallthetime.com. Go to our website, allhealthallthetime.com, and you'll learn more information about the topics that we're covering, not just on this program, but on other programs as well. You could also check out segments of the program on the website as well. In your practice, when you've seen melanoma patients, can you talk about some of the outcomes that you've seen with them and the process?
There's one that comes to mind, and I don't think I'll ever forget this. And actually, I saw it when I was in my training years. This was, again, not the classic patient, but this was a Hispanic. She was only 28 years old. And she had an invasive melanoma on the upper part of her arm. Actually, she was missing probably about 1/3, including muscle, because it was not detected early enough. Again, she was that patient that was probably, she was using tanning beds.
First, an invasive means?
That it had gone very deep. Already. So it's already invading muscle. So that patient actually ended up going for treatments to Moffitt Cancer Center. So she was only 28 years old, Hispanic patient. And she never thought she wasn't a prototype patient.
Sure.
And because of her tanning bed use, she developed a melanoma at the age of 28.
And the outcome?
Her entire arm was disfigured. She was missing about 1/3 of the thickness of her arm.
But she survived. She survived. And is that typically the case with melanoma? Once it gets invasive, it becomes disfiguring, extensive surgery?
Right. So if they're very superficial, we usually just excise them, which means they get surgically removed. As they become thicker, or obviously if there's lymph node spread as well as spread as to other organs, and they need to be referred out, usually put under general anesthesia for a more extensive surgery, and to also be able to check extension to the lymph nodes and see an oncologist for that.
And wrapping this up, what is the message you want to convey to people about just skin care in general?
So, skin cancer, like I said, is the most common skin cancer, but probably the most preventable. So definitely become sun smart, because a lot of it, if it's prevented and detected early, you can potentially save your life.
And you should know your family history. And if you're fair skin, you're more at risk, but you're not eliminated from risk if you're not.
Correct.
Okay. And finally, so it's suntan lotion and protection are the keys to really avoiding this. And you can enjoy the outside, but the point is you don't have to stay indoors and never go outside.
Exactly. So no, you could perfectly have a great day out in the outdoors, but do it safely.
How long have you been practicing?
I've been practicing for 3 years now.
Here in Miami?
Here in Miami.
Okay, and I imagine skin issues in Miami are a big deal.
Very big deal, very common.
Okay, thank you very much, Dr.
Yes,
Annie
thank you.
Gonzalez, dermatologist. We've been talking about skin cancer today and how to prevent it here on the Health Channel. Take a look at our website, allhealthallthetime.com. There's some really good information that's going to be on there. Remember, everybody is susceptible to skin cancer because everybody goes out in the sun. I'm Andrew Schmertz. Thanks for watching the Health Channel.